On behalf of the Markkula Center for Applied Ethics, we are excited to have you join us today for today's Get Vaccinated webinar. During the next half hour, we will be checking in with Lincoln Snyder on how Catholic schools are and should be responding to the COVID-19 pandemic and vaccinations as the school year gets underway. My name is Amana Liddell, and I am a senior at Santa Clara University. For the last couple of months, I've been working with the Ethics Center on the Get Vaccinated webinar series, and I will be hosting today's webinar. Our guest for today's webinar, a check-in with Catholic schools, is Lincoln Snyder, the President CEO of the National Catholic Education Association. Lincoln received his bachelor's degree from Georgetown University and his master's degree from St. Mary's University of Minnesota. Before starting his role as President CEO in the past July, Lincoln served as the superintendent and executive director of schools for the Diocese of Sacramento, as well as a teacher and member of several Catholic school boards. Lincoln, we are very excited to hear your insights today on the pandemic response in Catholic schools. I don't think I can hear you.
Thank you very much for the warm welcome. And I am a San Jose native, so it's doubly exciting to be having this conversation with my friends from Santa Clara University.
Yes, of course. So to go ahead and start us off, could you please tell us what strategies have you seen Catholic schools utilizing to make this start of the school year as safe as possible? And kind of which of these strategies have worked really well and which ones haven't worked as well?
That's a great question. Catholic schools really did lead the country in offering in-person instruction, and not just in California, but across the country last year. And in doing so, they really did gain a lot of very valuable experience about how to manage in-person instruction during the pandemic. And so as we came back to school this year, I think that, first of all, I think everybody nationally perhaps had let their guard down a little bit because things were looking so good over the summer. And we thought that we might be able to start relaxing some of those strategies we had put in place for the previous school year. In talking with school superintendents and school leaders, it's clear that they had to go back to that playbook from 2020, 2021 and start putting those things in place. And so to answer the second part of your question, there isn't one strategy that really enables us to operate safely. It's just a lot of different little things operating in concert. And so in Sacramento, for example, as we came back to campus, we really made sure we had different layers or tiers of mitigation in place that all worked together. So we had the stable cohorts for classrooms at our elementary schools. We had social distancing and masking on campus, attention to hygiene and hand washing and symptom screening. I think that the big thing that added an extra layer of safety was vaccination. The fact that our adults and then even our older students, for the most part, are vaccinated and have the ability to be vaccinated. Really does provide for a safe environment. So, or a much safer environment than we would have had without the vaccine. So.
Yes, that is a very good point. I think that's a large policy that we're kind of seeing become more and more commonplace in a lot of school districts outside of the Catholic schools across the country, is the requirement for vaccinations for not only teachers and administrators, but also for the older students above the age of 12 who are eligible at this time. So my next question for you is, how has the National Catholic Educational Association assisted the diocese in the start of the school year? And has there been guidelines or recommendations for regulations that have been provided?
Absolutely. So we, as the association, aren't the ones that are directing policy in terms of what has to happen, because in the Catholic school system, each school in collaboration with their local bishop are the ones that make the final decision as to what the policy is. So, that stated, we work very closely with groups like the CDC, or there's a Catholic coalition of healthcare professionals and organizations called Catholic Cares. And so we've worked really hard to provide a lot of resources to schools and to bishops and people on the ground in dioceses, so they can really have access to both the science behind COVID and behind vaccination and behind what works in terms of mitigating the spread of COVID, particularly in schools, as well as making sure that we're sharing out church teaching. The Holy Father, for example, has offered a lot of different statements on the importance of vaccination. And we know a lot of Catholics of conscience had concerns about how the vaccines were developed. And so we know that as concerns have come up, it's very important for us to be a place where people can go to find out, okay, what is the teaching and what's the data, and what is the actual policy, and what's good and what's not. So we've tried to be just that honest broker of information, making sure that we have things on our website, ncea.org, where schools and school leaders can go and access both science as well as teaching, as well as other thought leadership on the matter of COVID and things like vaccines.
That's great. I think a large issue that we've kind of run into throughout the pandemic is there's so much information coming from all of these places, and it really sounds like you guys have kind of helped to hone in on the important facts that people are really raising questions about and have concerns about, to kind of help people return to school with the peace of mind as much as they can.
Yeah, because we as Catholic school leaders, we're practitioners. I think that there's the science, but there's also the experience. And so, for example, there was a big debate in social media and press circles over the last few weeks about the efficacy of certain tests. And so, like, in Sacramento, I wrote the check for well over 20,000 PCR exams. No, excuse me, not PCR, but antigen exams, right? And so I think that having as school leaders been in the field and seen what works and seen what doesn't, I think that not only are we talking to data, but we're also saying, no, I mean, we've done tens of thousands of these tests, for example. In our experience, they are effective. So it's that also hands-on expertise that I think our school leaders are willing to share out with their communities.
Yes, and I think that kind of brings us to a good question of kind of, in what ways have you seen administrators and teachers and even parents and students kind of have to adapt and change in regards to schooling over the last kind of almost year and a half?
Great question. Our teachers were really heroes over the past year and a half, as they did everything they could to adapt to the new reality and make it as great as possible for our students. And so they went from, in Catholic school world, from in-person learning to distance learning essentially over one weekend in almost every diocese in the country. And that took a big jump on everybody's part, but they did it and they figured it out. And the same was true in coming back. Again, our Catholic schools tended to be the first back in whatever diocese they were operating in. And our teachers really did commit to doing that and doing it well. One of the changes this year, over the past year and a half, or the past school year rather, many of our teachers offered what we call dual delivery. In other words, they were teaching students at home and in the classroom at the same time. And the one big change for this year in most places we see nationally is there's been a division of that labor. In other words, for families that need a distance option, most dioceses are giving them an actual dedicated distance school. And so that the classroom teacher isn't doing essentially double duty of teaching kids in person at home. So, for the families that chose to remain in distance mode, there seem to be more and more dioceses that actually have now dedicated distance schools to support them, which is a trend, again, that we've tried to support and resource as the association.
Yeah, I think that's a very interesting kind of model of delivery, of kind of giving both options to families, because different families have different needs and things like that. And so I guess my next question for you would be something along the lines of, like, are vaccinations required for staff, and kind of how have those regulations been received by teachers and staff in schools?
So that varies from diocese to diocese. At the end of the day, the states and the local health officers are the ones setting the requirements. And of course, now there's been some movement on the national front with President Biden making certain statements about vaccine requirements. But until now, really each bishop was the one having to make the decision about what would happen with his employees within his diocese. And so it really has been a local decision. I think that stated the general trend is that bishops have been encouraging vaccination. And in most all dioceses I've encountered, the voluntary vaccination rates have been very, very high, right? So like in Sacramento, out of 1,000 people that are teaching in our schools, we had a handful that didn't get vaccinated simply for a reason other than a health concern, right? So I think that a lot of our dioceses have seen very, very high levels of teacher compliance around or a willingness to go out and get vaccinated on a voluntary basis. I know that there's a lot of conversation about some industries and vaccination rates, but again, in our experience, Catholic school teachers have been very, very compliant about getting vaccinated, even if it wasn't a requirement of their employer.
Mm-hmm. Great point. I think we've seen throughout the pandemic kind of how vaccinations has impacted and helped mitigate the spreading of the pandemic and kind of controlled cases at different points. And so vaccinations has been a very important part of this kind of tackling the pandemic in addition to masking and social distancing. And so, what would you say in response to a school staff member who is hesitant to get vaccinated? Because there are still people in that group.
Yeah, I think there's two layers to this, and one is for your own health. And I know a lot of people have concerns about how the vaccine, may or may not be healthy for them. And I say that there's a really big body of evidence on this that people who are vaccinated, um, generally speaking, don't die of COVID. In other words, you take the biggest risk of COVID, which is death, and set that aside. Now, of course, somebody might get it without the vaccine and recover, and a lot of people experience that. But our hospitals are full, and in some cases are turning away patients who would otherwise survive routine surgery for something like a gallbladder that now can't get into an ICU because it's filled with COVID patients. And that's the second piece of this, is that there's also, and the Holy Father has written about this, that concept of being vaccinated being an act of mercy for those around you too. Right. So we know that there's that individual decision whether or not to get vaccinated, but we also know that once people are vaccinated, they're much less likely to transmit it to someone else, even if they do get it. And I've seen this in my own household that, we had a member of my family who was too young to get vaccinated, to get COVID. And most of us didn't get it. The rest of us had all been vaccinated. One person did, but they had mild symptoms and didn't give it to anyone else. Right. So I think we're a pretty typical story for that, the consequences for us were far less, and it as a family, and it also meant that we weren't putting anybody else at risk of us giving it to them. And that really is the bigger picture that I think Pope Francis has written about really eloquently.
Yes, and I think that really brings up kind of an important point of there are many children who are in school right now in person that aren't eligible to get vaccinated, and they are still at risk for getting COVID. And I think as students across the country have begun returning to school this fall, we've seen a large increase in the pediatric cases of COVID and also the severe cases of COVID in pediatric patients. And so I think that's an important thing for families to be aware of. And I think it's also a big concern for parents with sending their kids to school who are unvaccinated and aren't eligible to get vaccinated yet. And so I think that's a really important conversation to kind of raise within schools and different places like that, where just not everyone is eligible or has that option right now. And so kind of what concerns have you heard from parents in regards to safely reopening schools and kind of why they may be hesitant to send their kid back to school?
Kids are more efficient transmitters of this Delta variant than they were of COVID in the past. And so we saw this, we saw last year that kids really weren't giving it to each other. That appears to have changed, that kids can simply give Delta to one another far more efficiently than they could previous variants of the disease. And not that it's more severe. And so again, with my youngest, he was kind of the stereotypical Delta case in that he was doing all the same things we had in place all for a year and a half, only playing outdoors, not socializing closely indoors with other kids. Really hadn't done anything different. We don't know where he got it. Probably picked it up at Walmart, doing back to school shopping. We just don't know. And so, not to blame Walmart, by the way, it's just one of those things. And so, and we're hearing a lot of stories about that with Delta, that people that haven't been behaving any more riskily than they had are suddenly getting it anyway. And so something's changed. And I think that in looking at our youngest students that aren't eligible for that vaccine, yeah, we do need to keep our guard up and our wits about us as we go into the school year. Again, not that the kids are at greater risk of mortality now than they were. I mean, I still strongly believe kids need to be in school and it's the best place for them. But this isn't a time for us to be dialing back all of the safeguards we have in place. We have proven that when all of those layers of mitigation are in place, they work. They really slow down the spread of this disease. And so is school safe? Well, if kids are in stable cohorts and socially distant and have the hygiene and the screening and the masking requirements, and they're in front of a vaccinated adult, I mean, as you layer those things up, the risk just goes down and down and down and down and down. And that's why we're really encouraging our families to be patient. I know everybody's sick of it. Everybody's over it. They don't want to keep having to do all these things, but the reason we're doing them is because we've proven that they work. And unfortunately, while we're still in this environment where we're, dealing with these big spikes in COVID, it's just something that we're going to have to continue to do. But again, please, folks, be patient with us. The reason we're asking you to do this is because it kept our kids safe last year, and it's going to keep them safe this year too if we continue to do it.
That's a kind of great piece of advice, and kind of brings me to my next question is kind of what advice would you give to parents who are upset about their school's regulations, whether it's that there's too many regulations or not enough regulations?
Yeah, we obviously have seen people with very passionate opinions on this issue, especially the issue of masking seems to be a very emotional one for parents around their kids. I was superintendent of a district with 13,000 students, and they were masked last year, and we did not see a social emotional toll from that. There is a social emotional toll that's far greater than anything you can imagine when kids can't be in school full stop. So one of the things we learned from Catholic school is that when we're doing all these things, but keeping kids in person and in class, their learning doesn't suffer. So in Sacramento, for example, we got the test feedback. Kids didn't lose last year. They grew an academic year during the year on average, according to our testing results. And so, if it's really important to do everything we can to keep kids in class. When we're moving forward, the kids are still learning, and it means they're not losing ground, which for us as teachers is always our biggest concern. If we were to have to shut down again and be unable to offer instruction, I'm concerned that that's where kids will really start to suffer. It's very hard for a child to catch up once they've lost an academic year or even half a year. And that's something that for us as educators, we're just keeping in the forefront.
Mhm. And I think that kind of brings up the point of children are very affected by the pandemic and how schools have had to kind of modify to make sure that if students are in class, it is being done safely. And so whether it's masking or social distancing or school being taught online for the period that it was, how have you seen children be impacted by these changes in schools?
Well, we're social animals, and I think everybody suffers a little bit when we're not in community together. I mean, I think that that's how we're wired as a species, is we feed off the energy and the presence of others. And it's hard for a little person to be home without that interaction. It's not good for their development. It's not good for their feelings. We need to do everything we can to keep kids engaged with community, because that's the food on which they grow socially, is that community in that interaction. I think that for us as Catholic schools, we made the decision that it was better to be careful and tear up the mitigation, but then come back so we could balance, the risk versus the reward of being in person. And I'd say that I think we proved that we made the right choice. And yes, doing everything we could to be safe, but also committing to being in community, because that's how kids grow, and it's really what they need for their minds and their hearts.
Yes, I think that's a very kind of good point. And I guess that also brings me to kind of another question is it is a situation that a lot of schools are running into where a child is testing positive in a class. And so I guess my question is, how have you seen schools respond to that type of situation so far, or if that has happened?
Yeah, a lot more schools had to quarantine at the start of this school year than we expected or they expected, right? So I think that's just one of the realities of Delta. It was, for many, it kind of felt like grand opening and grand quarantine, right? And so we went straight from returning to school to quarantining in many, many schools. And some schools have seen more quarantines in the last month than they did all of last school year. We know that that's an interruption, but it's also something that we've prepared for. The schools know how to deal with quarantine. Kids go home. If the teacher they switch straight into distance learning, and the kids are able to not lose pace even if their class has to quarantine. We know that this is just a reality we're going to have to live with. Again, last year we had a lot of quarantines from school to school and class to class, but we were still able to keep kids on track and growing for the year. And so I would just trust that this year will be the same, as that there'll be interruptions, but on the whole, our teachers will be working very hard to make sure the kids stay on track over the course of the year.
Yes, I think that's a very good point, is kind of there has to be kind of this element of being able to adapt, but also knowing kind of what the school's goals are and kind of that we do really want students to be in classrooms, but only when that is a safe option for everyone involved. And I think that's really an important point, is that children should be in school, but as long as it is safe and they are not at more of a risk than they need to be.
Indeed.
Um, and so kind of with that, I guess my final question for you today as we come to a close is, what advice would you give to school administrators and teachers as they kind of push on through this school year? And also on the flip side of that, parents and students as they are also having to adapt and change and are affected by schools policies that are in place?
I think that taking a deep breath and viewing this with some emotional distance, and most importantly, being patient and being kind to those around you is the most important thing we can do right now. Again, we know people are tired, they're cranky, they're over it. It's not easy for anyone, and it's been going on for a very long time. If I just had one wish for everyone, it was just, it would be that, communities talk about that openly. And we know that everybody's kind of, in some cases, at their wits' end with COVID, and they just want it to be over. Everybody understands that. I think that the most important thing communities can do is take a deep breath and really just reaffirm that we're all in this together, and the schools are doing everything they can to balance those interests, keep them in person and keep them safe. And there's always going to be a tension there. We're not going to please everybody, but we're doing what we're doing based on the experience of the last year, and always with the best interests of everybody's child in mind. So yeah, really just that call to patience and that call to kindness for each other. This too shall pass, and I know we'll look back and say, wow, we got through that. That was crazy. But that's our reality that's been given to us, and it's really up to us to just face it as a community together.
Yes, I definitely will be very thankful when that day comes, or we can say we made it, we did it, we're done with all of COVID for sure. Well, Lincoln, thank you so much for joining us today and sharing these insights about COVID and vaccinations and returning to school from the Catholic schools perspective. And thank you everyone in our audience today for joining us. And please be on the lookout for more information on our next Get Vaccinated webinar. And for more information on the Get Vaccinated campaign, please go to the Ethics Center website. Thank you everyone for joining us today.